I'm Dr. Anil Kapur. I'm the chairman of the World Diabetes Foundation, which is a Danish organization providing funding for prevention and care for diabetes in the developing world. I now live in India, and in the past I have been the managing director and the vice president for Novo Nordisk in India. Well, I've been involved myself with dealing with the diabetes issues in the country from the early or the mid 80s. And I'd say that the burden of diabetes has grown tenfold from the early 80s to now, and to the extent that now we have estimated about 70 million or 7 crore people with diabetes, and there's another 35 million people who have prediabetes, which is a condition which makes them extremely vulnerable to go on to get diabetes. But the important point is that most of the people with diabetes, or a large majority of them, don't even know that they have diabetes. The people who know they have diabetes are, many of them are not being treated in a structured way, and therefore we land up with many problems of complications. And diabetes is a complicated disease, and it affects every organ system in the body. Well, the underlying risk factors are obviously the issue that there is a certain amount of genetic inheritance to the risk. The other is the issues around unhealthy lifestyle. And unhealthy lifestyle is nutrition that is not healthy, which is basically high in fat, high in carbohydrates, highly processed foods, inability to do exercise, and inability to do physical activity. Then there are other risk factors that play on top of that, and that is like unhealthy use of alcohol or smoking. But there's another very important element that is being missed and not known to many people, is that many times we get programmed to develop diabetes when we are small. When we were born, we were in the mother's womb. At that point in time, we get programmed, and many times this is an issue that is happening in our country, where a lot of people who are born small, and children who are born small, are extremely vulnerable to future diabetes. Similarly, children that are born big are also vulnerable to diabetes in the future. So the health of the mother is also becoming an important element in this whole issue about diabetes and the rising burden of diabetes. The issue is that many people think that treating diabetes is expensive. My own view on that is that preventing and treating diabetes is not expensive. Not treating diabetes is very expensive, because all the expenses that come and are often related to diabetes are not because of diabetes per se, it is because of the complications of diabetes. And most of the complications of diabetes are actually preventable. They are preventable by good diabetes care. So if you don't have good diabetes care, if you're not taking care, then you're likely to get complications, and these complications are very expensive. For example, people with diabetes get kidney problems, leading to a renal shutdown. People with diabetes are extremely vulnerable to strokes, to heart attacks, to amputations because of infections in the foot, becoming blind. So diabetes impacts every organ system in the body, and if we don't take care of it, it is likely to cause complications. These complications are expensive. The most important element is that if you are treating diabetes and you're not achieving outcomes, then it is even more expensive, because you are investing money in treating but not getting any returns of it. So from a policy point of view, from a public health point of view, I'd say that providing care and providing for prevention and care for diabetes is actually a economically sound thing. Not providing care for it is what will cause financial. And the issue is that many people are able to provide even out of pocket for regular diabetes care. But when they have to get hospitalized for a complication of diabetes, then they have to borrow money, and sometimes they go into indebtedness. They have catastrophic health expenditure, which drives them back into poverty. I'll give you a simple example. People with diabetes get what is called as neuropathy. So their feet become insensitive and they are likely to hurt their feet. Now it takes roughly about $2 to educate a person with diabetes who has neuropathy on how to take care of the feet so that they can avoid injuries. If they get injured, they need to take early action. When you don't do that, and a person gets an ulcer, hurts himself, gets infected, gets an ulcer, because they don't feel the pain, they don't take care of it. So the ulcer may grow, right? And this becomes a non-healing infected ulcer for which the patient would need to be hospitalized. And it might take 6 weeks of hospitalization, and we have done estimate that it might cost up to $450, right? So that's an expense. Now many times this thing may not heal and the patient may need foot to be amputated, and that costs money. And if that has been done, then you need a prosthesis, and that costs money. So investing in that $2 of educating a person to prevent it can actually save you those high expenses. But the tragedy in the whole system, and well, in our country, most of us do not even have health insurance and coverage. But even in the Western world where they have, the tragedy is that the insurance doesn't pay for the education to prevent that ulcer, but will pay for the amputation, will pay for the hospitalization. And that's a completely distorted way the health systems are working. So it is the complications of diabetes that become expensive, and we need to avoid that, and that can be avoided by good care. In a country like ours, we have to understand that it is unfortunate that 60 to 70% of healthcare is in the private sector. The 30% that is in the public sector, a large portion of it is in terms of hospitals, big cities. Primary care in our country has completely become negligible, and what it is focusing on is on maternal health, which is very much needed, which is very much required, but it is not taking care of anything else. And until and unless we bring the care for chronic non-communicable diseases at the primary care level, there are many people who will not be able to access care. The other issue that many times people don't understand is that even if you say you're providing care for free, it costs people to access that care. If a person with diabetes has to go to a clinic, to a doctor, on a regular basis, it means loss of productive mandates, it means travel costs, it means taking leave, and these are productivity losses. So we need to ensure that primary care provides that and provides efficient and good care. If I'm a villager and I'm going to the primary care center, and half the time I don't have a doctor available there who can actually treat my diabetes, or who can understand that the foot ulcer I have is because of diabetes and I need good care for it, then I'm wasting my time and resources. Or if I go there and one time I get medicine, the next time there are no medicines available, I'm not going to go there continuously, and that would lead to disrupted care, which is as good as no care. So we need to have the government take more proactive actions to provide at the primary care level basic services for at least 2 or 3 of the non-communicable diseases: diabetes, high blood pressure, asthma. These are some of the common conditions that can be actually dealt with at the primary care. The World Diabetes Foundation was set up by a donation from Novo Nordisk, which is one of the largest companies in the area of diabetes care globally. And they made a donation and set up an independent foundation with the mandate that the foundation will fund programs for improving prevention, and access to diabetes care in the developing world. So since the last 15 years, the foundation was established in 2002. The last 15 years, the foundation has distributed something like 135 million US dollars to different projects around the world. And for each of these projects that we give $1, we are able to attract $2 in cash or kind from other sources. And as a consequence of this, we have projects running in about 115 countries around the world, where we have developed very innovative models for providing access to prevention and care. Like in India, we have funded many programs in the area of prevention of blindness because of diabetes by taking mobile vans to the villages with all the equipment that they require, or teaching doctors and nurses about how to take care of the diabetic foot. We also worked very extensively in the issue of women getting diabetes during pregnancy, and that's a very critical area, so we've been working on that. The other area that we have focused attention on is the double burden and the double risk of diabetes and tuberculosis. And I'd like to just spend a minute on that people fail to realize that people with diabetes are extremely vulnerable to tuberculosis. They are at 3 times higher risk. And we've done studies in parts of India, and particularly in South India, where almost 35 to 50% of people with tuberculosis have diabetes. Half of them don't even know. Now, why is this important? Is because in the presence of diabetes, drug interactions, the effectiveness of the treatment is less, and many times these people will continue to remain infective for a long period of time, and they might actually develop multi-drug resistant tuberculosis. So those are issues that are relevant. So we are trying to focus attention on that, and we've been successful with the government of India taking this cognizance of this, and we have a national policy around that now.